Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're here talking about a bunch of different topics. We are going to talk about breast lifts now. We talked about mommy makeovers, so let's talk about breast lifts.
Okay.
When do you know that you need a breast lift? Because a lot of women have the natural sag and it looks great, but I think a lot of us are looking at photos and thinking, I can't have any sag at all.
Sure.
So it's confusing. So when do we really need that breast lift?
I think with any cosmetic procedure, it's elective. So if it's something that's bothering someone, then that's a good time to start talking about it and see what the pros and cons are.
Okay.
If it's not bothering someone, don't fix it.
Absolutely.
I think that's a very good rule for many things in life, but for cosmetic surgery in particular. There are compromises with breast lifts. When we do a lift, we don't have a skin shrinking way. We don't have a way to sort of lift up that part like we do in the mirror.
Right.
We have to remove extra skin, and we're really pushing everything up with that. So there are some scars.
Right. Where are the scars?
The scars, there's always one around the nipple, around the areola, because usually the nipple is low.
Okay.
So the two things I'm worried about with breast lifts are getting the nipple into a perky position up farther, higher on the breast.
That's nice.
And the other is keeping the breast tissue above the fold.
Oh,
So when we have a lot of tissue below the fold, that's where the pencil test comes in.
It's the pencil test.
Yeah, that means that there's breast tissue hanging over the inframammary fold. So that can be done sometimes with just a vertical scar that goes from the areola down, or sometimes it incorporates a horizontal scar, and sometimes it uses both. We need to use both to get it right. Each of those scars allows me to pull and sort of reposition in a different way, and really a breast lift is changing the shape of the breast more than lifting it.
Changing it back to a normal shape.
Exactly.
With the natural sag still intact. So there's a lot of women out there that probably just go, you know what, I probably need one, but I don't want to go through it. I don't want the scars. The scars really scare them. What can you say to those women? And what has put them over the edge sometimes to actually do the surgery? Because it scares.
Well, it is a scary thing. And I've had the situation where we're trying to do a smaller operation to get the lift done when someone's right on the borderline. I'll usually explain that to them. It's like, we might be able to get away with doing a little bit less, we might not.
Oh, okay.
And for people who really don't want the scar, we'll try and do a little bit less. And I can tell you there's been a lot of situations where it doesn't quite lift it up where we want to, or it stretches the areola out.
Right.
And then we go back and revise it, and they're very happy. Even though they have more scar, they're like, oh yeah, this is a much better result.
Yeah.
So it is a compromise. It's something you really need to talk to your doctor about and ask them,
so you get
what are the benefits, what are the risks, where will the scars be, is there a way to eliminate them, keep them smaller, how do we hide them?
And you get good feedback, people come in, and the scars do fade. I mean, it's not like the scars are going to stay there forever bright red.
They do fade, but if I have someone who says, I just don't want to have a scar, I can't do the procedure for them.
Okay.
It's part of the deal. You have to accept that as part of the process.
Absolutely. Let's go to before and after photos.
Same idea here. So we've added some volume and done a lift. Now you might say, well, she didn't really need a lift. The nipple's not really low.
Right.
But her nipple is below her inframammary fold in that before picture.
Implant on the after picture?
Implant on the after picture.
Those look really good.
So the implant without the lift would again push the nipple lower.
Yeah.
With the lift, keeps it in the right
very
position.
natural. Very natural.
That's where it's supposed to be. So it's all about the proportion.
Next photo.
So there's a side view. So you can really see the nipples kind of low and below the fold. Afterwards, there's less tissue below the inframammary fold, that little crease under the breast, and the nipple's been lifted back up.
And no implant in that, obviously, right?
No implant for that.
Looks very good. Next picture.
And same idea here, just lifting, repositioning the breast tissue that's there.
Perfect.
It's hard to get fullness way up high.
Yeah.
Because the nipple needs its blood supply, so the breast tissue under the nipple has to stay there. So if someone doesn't like that little bit of step off from the chest to the breast, then we add a little bit of an implant in there. But it looks very normal.
Next photo.
Same idea here. So again, added a little bit of volume,
looks great
done a lift. There's some asymmetry before. We've tried to correct that. It's hard to get things perfect, especially when they're not starting perfect, but we can usually make it better.
Can't see the scars. And we have another picture? No more pictures.
Look, it's us.
Wait, that's us. Hey. What about fat transfer? Can you fill the top with a little fat transfer if you can?
Fat transfer, I like it for spot defects. So if someone has a breast biopsy and there's a divot, I think it works really well in there. For augmenting the breast, sometimes we can't get enough volume to make it work.
All right. More information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. Lots more to come. Stay right here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.